Doctors of Reddit, what is the weirdest thing a patient wouldn't admit? That they don't know how to read. I've been taught the trick of handing a paper upside down to them to see if they can read. It's good to know if they don't, so you can make extra sure they have a full understanding of their instructions instead of saying to read the details on the sheet. I volunteer at an prisoner shoved a ballpoint pen up his urethra to get out of being stabbed. If I recall correctly, insisted he had no idea how it got there. We spent hours deliberating how to get it out, and he just reaches down, still in his handcuffs, and pulls it out himself. Not a doctor but my husband. He had a 17-year-old girl with abdominal pains come into the with her mum. Turns out she's in full-blown labor. Assures them she can't be pregnant. She's a virgin. The baby is literally crowning right there in no maternity ward in their hospital, and she was in advanced labor when she arrived and she still insists she's a virgin. My mother is a nurse and told me about the time some lady came in for abdominal pains as well. Yep. She was pregnant and gave birth, and as soon as the baby was out she screamed, "It's not mine." Mom responded with, "It didn't come out of me." That she could actually see. We had this lady that came into the at least once per month, usually cheap pain. She was 30s, morbidly obese. She had seen multiple specialists, had her heart, lungs, and GI system examined in almost every conceivable way. One night she comes in with sudden onset blindness. Not her first time with this complaint either. Last time she got a trip to the retina specialist. When I examine her, I walk around her bed and she tells her friend to get her feet off the chair so I can get by. She plays it off super cool by adding, "If you have your feet up like you always do." Then the neurological exam. I have her touch her nose, then touch my finger. Her idea of how a blind person would perform this exam is to touch her nose, then wobble her hand from side to side as she touched the end of my finger. Not to mention the near constant eye contact as we talked. I would ask a question and start moving while she talked, and she would follow my eye perfectly. She was extremely relieved to find out she had conversion disorder and that her sight would be back soon. How a 20-ounce glass Coke bottle was lodged all the way up a guy's rectum. He denied it vehemently in front of his wife. That was weird. And awkward. Maybe his wife really likes Pepsi. vet student. Many clients like to say I don't overfeed my dog. That's just a normal size. When their pet looks like a watermelon. Not a doctor yet, but was volunteering in the emergency ward, and a woman came in with her pregnant daughter. Not only did she refuse to believe her daughter was pregnant, but was feeding her laxatives to deal with the extra weight. It was pretty horrible stuff. Had a patient refuse to admit he swallowed a pen, even though an X-ray showed the pen in his small bowel and we took the pen out during an emergency surgery. That's not mine. I'm holding it for a friend. I guess it's not super weird that this patient wouldn't admit this, but it's weird in the sense that it was super obvious what happened, so he might as well just admit it. I used to do patient registration in the Two of us were wheeling around our computers and registering patients off of ambulances and getting patient information in rooms. A middle-aged guy comes in on an ambulance and my coworker takes it. So I'm finishing up some paperwork and I go to our front office and pull up the patient tracker board so I can see what still needs to be done, and a new patient pops up on the board. Chief complaint. Eyeliner pen stuck in penis. My coworker walks into the office looking scarred. She explained the nurse asked him what happened and he said he slipped. She told him that doesn't seem likely, so he said he had an itch and thought it would help. We later found out from the nurse that he finally admitted that he saw it on TV and thought it would feel good. His 20-something-year-old daughter was with him, but she clearly had some form of developmental disability. It was all around a sad situation, and I hope someone told him about sounding and he did some research on safe practices for kinks. Apparently they were both lodged in there pretty badly. Once had a woman come in for a possible yeast infection. On exam she had a glass bottle stuck in her vaginal filled with urine. Totally wouldn't admit it was hers or explain how it got there even after we removed it. Just kept saying, "I think this is all a joke and you put it up there." Yeah, she was totally trying to cheat a drug test. Definitely. The bottle had an overly complicated apparatus which allowed her to discreetly trigger the urine to come out, which made it all the more weird. She pretended we hadn't just pulled CIA tech out of her cooch. Not a doctor, but a nurse. When you come into the hospital wanting to detox, And I ask you how much you drink. Please stop lying to me. Withdrawal from alcohol is nasty, but I can make it a little more bearable. If it's 2 bottles of vodka a day, tell me so I can medicate you accordingly. You'll thank me later when you aren't having a seizure. How the remote control to a Zenith television wound up in the rectum of a 54-year-old father of 2. They stopped making Zenith television sets years ago. From a medical perspective, why do you still own this remote? Not a drive, but worked in a hospital for a long time, had a PT come in that had OD on heroin, was able to get him set on that front. However, he had necrotizing fasciitis in his pectoral from injecting there. He was septic and honestly a bit of an asshole. He kept trying to tell us the reason he was there was because of a motorcycle accident. We all knew, but he was in absolute denial. He eventually heals up and transfers out. After a couple months, he came back about 6 months later to say thank you to all of us and to apologize for all the lies and arseholeish behavior. Seems it was enough to get him out of that life and onto a new one. I think about him now and then and hope he stayed clean. All the symptoms of pregnancy plus 2 positive pregnancy tests. There's 0% chance I can be pregnant. I'm not married. To be fair, the patient's mother was there and this was in a very conservative country. She ended up admitting she was pregnant when we separated her from the mom. I'm a nurse, not a doctor, but it's amazing how many patients lie about how much they drink. Dude, we aren't judging you. We just want to know if we need to worry about you detoxing when you come out of open heart or any other surgery. When was their last meal? They think they can fool their PET scan, end up losing money, time and over irradiated. I feel your frustration to my soul. Sir, have you eaten this morning? Nope. Not since before midnight. Meanwhile, I'm looking at a sliver of contracted gallbladder. Are you sure? Because I would hate for this test to come back incorrect and you end up meeting with a surgeon when you don't need to. ... I might have had a couple of waffles and eggs. I'm a gastroenterologist. I do upper endoscopies all the time. Somehow, there are people out there who think they can get away lying about whether they've eaten since midnight, before a procedure that will literally stick a camera into their stomach. Now, some people have gastroparesis and old food residue will be present in the stomach, but I've literally seen fresh, chewed but identifiable bacon and eggs hanging out in the stomach, in addition to probably making it a lot harder to diagnose whatever we were doing the endoscopy for. It's also a huge risk for aspiration events, which can be lethal. Had an elderly lady from a nursing home come in super altered. She would wake up briefly to answer questions but then would be out like a light seconds later. Usually in this case we assume it's from infection, stroke, etc. But we still ask about drug use, legal and illicit, since it can cause that kind of thing. Lady denied several times she didn't take anything other than prescribed meds. Finally, as we're about to intubate her, put her on a ventilator since she was getting worse. We cut off her bra and out pops a little baggie with some white powder and a baby straw. We gave her some Narcan and she gasps herself awake. Even after that still took her a long time before she said, well, maybe I did take some drugs from a friend. Since then I've trusted no one when it comes to denying drug use. On my surgery rotation as a med student. Warning, this is gross as f***. Had a patient recovering from having parts of the bowel removed. As part of the recovery, their intestines weren't completely connected to let them heal better. So the intestines were connected to a little hole in the skin with a bag attached for the poop to go into, known as a colostomy bag. For reference, this woman was in her late 60s and over 230 pounds. I had to round on her every day, and every single day I'd walk into her laying in bed absolutely covered in toxic gasoline-smelling diarrhea. She also had C. diff, a nasty bacteria that anyone in the hospital can identify by smell, and she would flirt with the residents and make casual conversation while we would clean the shit off of her and fix her ostomy bag. One day we walked up to the room and the chief resident walked in the room, immediately walked back out and closed the door behind him, looked up to all of us following him and went, she's fingering herself covered in shit. I really wish I was making this up. So yeah, she never admitted it, but obviously she was tearing at all the tape covering her ostomy all night until she broke the seal and could get herself covered in shit again to get attention from the doctors. Only work records in a clinic, but we had a woman come in with a report of vaginal odor. All well and good. It happens all the time in an ob-gyn clinic. What she hadn't bothered to say was that she'd gotten a tampon stuck around the end of her last period. She'd gone through menopause 7 years prior. I want to make sure I'm understanding this clearly. She had a tampon stuck in her vagina for 7 years. I didn't go into her chart, but according to the medical assistant that was in the room, yes. The rest of us needed no more proof than what our noses found in the hallway. I can literally smell the smoke on your clothes and breath. See the nicotine stains on your fingers. And you're trying to tell me you quit smoking 10 years ago? During my pediatric rotation, parents would often say I don't smoke in front of the kids, but when your kid's hair smells like smoke. There was a woman sent in by her family doctor for urinating some blood. We put a camera into her bladder with her awake, looking to exclude a tumor. We found her bladder full of citrus seeds. So many of them. When asked why she put them there, she said, "Well, I eat a lot of fruit," and wouldn't accept any responsibility for them being there.